part of this great service. So, today, my dear audience, we have this amazing opportunity to listen to one of the biggest names ever written in the history of community ophthalmology. Yes, the name is Dr. Praveen Vashist, sir. Thank you so much for coming and accepting our humble invitation. Thank you so much. I welcome you on behalf of every student. We are delighted and we are really lucky to have you in between of us. Thank you so much, sir.
Thank you, Malik. Thank you, Malik.
Before we move forward, I cannot keep myself from saying some things which I learned about him. So, he has so many feathers in caps, it becomes difficult to prioritize which to say. He is a selfless community ophthalmology worker. He is the professor and HOD of community ophthalmology at RP Center AIIMS. It means a lot. His selfless passion for community ophthalmology has penetrated deep into schools and urban slums and has saved millions of lives, millions of sight. That makes a lot of difference. This is absolutely hashtag goals. Yes, my friends. He has strengthened epidemiological research and training in the field of ophthalmology. And actively being involved in research, he has published nearly 50 journals nationally and internationally. It means a lot, sir. He is AIIMS Excellence Award winner of year 2014. And my dear friends, he is a gold medalist of community eye care worker, of community ophthalmology. So we have this absolute gem in between of us, and this upcoming hour is priceless. It is priceless. So give your 110% attention. This is something really amazing coming and waiting for us. This is honestly the World Sight Day gift to all the optometrists from this beautiful, beautiful leader. Thank you so much, everyone, every one of you. May I please call upon Professor Monica Chaudhary, ma'am, to please come and address our guest. And before that, before she comes up, I would like to thank her for this opportunity, for her passion, which is there to inculcate in us, in the students, every day, to make us more passionate about our subjects every day, to bring in the best leaders, the best people of optometry, and giving us the chance to learn something every day, every single day. Thank you so much, ma'am, for this wonderful session, for this wonderful morning. Can I please have you on stage, please?
Thank you, Malika. I was so much delighted to see the introduction, and I feel good as a teacher today that we have students like you all who are hosting this show. And it's fun for us to listen and be proud of what you all are doing. And to introduce Malika a little more before she's introducing all of us, the introduction is, she comes from a legacy of optometry, and her father has been fighting a lot for the prevention of blindness and has done a lot for the profession in his state and otherwise. So he's also a dedicated, selfless worker. Okay, to begin with the celebration, which we say is World Sight Day. And one thing we realize, yes, this celebration is every second Thursday of October. But why do we celebrate it? Is it just because we circulate these WhatsApp messages and friendship notes to each other to remind each other of a World Sight Day celebration? It's actually to sensitize everybody that we have to prevent blindness. And I wonder how many of us have realized it when we were sending these messages and felicitating each other and celebrating it. So it is here the opportunity today for all of us. And as Malika, you've said, Sir is here, who's been bringing in this kind of thoughts and his wisdom and insights. When he talks about the priorities today on blindness prevention, I think each one of us is just not listening to it as a lecture today. You have to think about ideas where optometry can play the role in prevention of blindness. It's a big burden on us, I say, as optometrists, because this profession was created to prevent blindness. We lost ourselves into it. We started debating and fighting for many other things, but we forgot to debate that our own role is prevention of blindness for the society. And the day every optometrist realizes that his role is this, believe me, all that we want, regularization, legalizations, our preferences, our rights, our duties, will fall in place. So I think I won't say much. We would love to listen to Sir. And I would also say thank you to Dr. Sumit Grover. We are so honored and privileged to have such a person with us who's bringing in a model of co-management. And he's the one who's always been getting Dr. Praveen here. Dr. Praveen is an idol for many of us, and we look forward to reading his posts, his sessions, his journal, our articles, and all that he's been doing it. So we all are here. I would again say, put your mics off, sit in the chat box, listen to everything, and type your questions. By this end of the hour, we have to realize where is what I have to do for till the next World Sight Day, where is my role and how I can contribute. So thank you so much, sir. And thank you, Malika. Over to you.
Thank you so much, ma'am, for your inspiring words. Before we call upon Dr. PraveenVashist, I would like to call upon our own eye health hero, Dr. Sumit Grover, sir, to please come up and speak a few words about this beautiful, amazing personality between us today. Thank you so much. Can I please have you on?
Thank you, Malika. It's a matter of privilege and honor for me. And I feel very shy in front of him because he is not only my teacher but my mentor, and he's like my father figure. And today, while moderating his session, it's like a dream come true. You know what happening from the last 4 5 years. Then when my turn comes to speak up on any conference or something like that, Sir was not there because of some unavoidable circumstances. He had to leave a day before or a day later or something like that. So from last 4 5 years, I just earned to, speak in front of him or just to express and my words. And today the dream come true for me to just moderate the session. He's a wonderful personality, a humble human being. As you already rightly said, Sir is professor and head community ophthalmology. RP Center AIIMS, the apex center for community ophthalmology in India. He has also became the vice president of Vision 2020 Right to Sight India, which is a very very prestigious chair. And he has been instrumental and as a technical advisor to the National Program of Control of Blindness. I have never seen any NPCB guidelines and policies which he hasn't seen. His ideas, his advices are always well taken by the ministry. He is the principal investigator of 52 research and community eye care projects. And he was instrumental in National Trachoma Prevalence Survey and National Trachoma Rapid Assessment Survey. He actually introduced in India what are the RAP surveys are. And the latest prevalence of blindness in India was given under his able leadership. Supervised many PhD scholars, many postgraduate students, and delivered more than 400 lectures as a resource person. And Malika, you said that he has been awarded as an AIIMS Excellence Award for the best researcher, not only in 2014, but in 2016 as well. So it's indeed an honor to have you with us, sir. And without wasting any other time, I just invite you to enlighten us more. This always amazing to hear your words. Thank you so much, sir, and over to you.
Thank you, Sumit. Thank you, Monica ji. Thank you, Malika. In fact, I am honored. I am delighted to be part of your program, your World Sight Day celebration. And in fact, last week I was not well. Same day I got my COVID test done because of fever and malaise, everything. And I was requesting Sumit, it may be delayed if I'm positive myself with COVID. But luckily I was negative, and at that time I came to know that Sumit's entire family, they suffered with COVID. Sumit, you have come out. It is nice. Monica ji, for student, I must tell that I joined AIIMS in 2003. And at that time when I asked my senior faculty, who is the best optometrist in AIIMS, most reputed, everyone named Monica Chaudhary. So in 2003, she was the best reputed optometrist in AIIMS. And I had special attachment with her. After that, when she left AIIMS, she joined IGNOU and then in Ansal and now Sushant. In fact, everywhere she has invited me in 1 or 2 sessions, and I am always felt proud that I'm part of like her attachment. And in fact, whenever I got opportunity, that Optometry Association, they should represent NPCB or other higher bodies, then I always thought of Monica first, that she should be the person who lead the Optometry Association in our country. A very, very nice lady, very nice person, and I had a very, very affectionate attachment with you, madam. Thank you. And as far as Sumit is concerned, I know Sumit for last 5-6 years. In fact, I can tell you right now, Sumit is, I can see the future actually. He is probably the best community ophthalmologist for our country. You don't know he did. I'm so happy that I actually refer him for ICH, doing for MSc in Public Health and Eye Care. And he has got nearly 87% marks, ever highest by any person, at least from India. I know GVS Murthy, Sanjeev Gupta, they were topper of their batches. He is the one got highest mark from International Center for Eye Health. So automatically the international agencies are saying that Sumit is the best community ophthalmologist for our country. So Sumit, congratulations for that. And not only ICA, this time IAPB, International Agency for Prevention of Blindness. This is the agency which started Vision 2020 Right to Sight program. They have also honored Sumit with Eye Hero Award for the country. So congratulations, Sumit. It's actually, you say that I'm your mentor, but I am looking forward to you as a very good friend, a good person who will be working hard for community ophthalmologists for our country. So best wishes, Sumit, for your future actually.
Thank you so much.
So I think I would like to share my slides, Sumit. This
Yes.
is present now.
Sir, yeah, sir, when you share entire screen, not the window,
Yeah.
so that we can see you only then.
I would request every student to please pin Dr. Vashist's screen so that you can easily understand what he's talking about. Thank you so much, sir.
Hope you can see my slide.
Yes, sir.
Is it visible? Yeah.
Yes, sir.
Yes, sir.
Yes, sir.
Actually, I can't. Yeah, it is going.
We can see, sir.
Yeah, fine. So I'll be talking about National Program for Control of Blindness and Visual Impairment, the current priorities under this program. And in fact, before this, I must congratulate all of you for the celebrating World Sight Day. I hope the students know that India adopted this Vision 2020 Right to Sight program in 2004. It was actually a global program which was started by International Agency for Prevention of Blindness in 1999 and one side, and WHO, which represent government bodies. So IAPB represent all INGOs working in this area, professional bodies, and WHO represent government agencies. So it is an integrated program among all the stakeholders, whether government, whether it is INGOs, whether professional bodies, everyone was part of Vision 2020 Right to Sight program. And since 2004, we have been celebrating this World Sight Day. Every year there is a theme, and this year the theme is Hope in Sight. As far as National Program for Control of Blindness and Visual Impairment in India is concerned, India was the first country globally to launch a national program for control of blindness. At that time, the name was NPCB only, and this visual impairment component was added in 2017. So in 1976, the program was launched, and NPCB basically is given importance because they are the policy makers from government side. They monitor the program and eye care activities. They evaluate those activities and policies. They are also budget providers to NGO partners who are working, in fact, also the government agencies. And as a supporter, so that's why the NPCB is always given a priority in our country as far as eye care is concerned. Previously, it was 100% centrally sponsored program, but currently that has been changed. Now, state and central, they contribute, 60% is being contributed by central government and 40% by state governments. In fact, in Northeast, we give higher priorities. In Northeast, 90% is funded by central government and only 10% by the state governments. we use a decentralized approach. That means the planning, whatever is being done, is at the level of districts. So it was initially launched into 640 districts in the country, and currently we have around 739 districts, and in almost all the districts the program is being implemented. Till 12 5-year plan, it was every 5-year budget and planning and activities were prioritized. But after 2017, it was for 3 years till 2020, and it was part of non-communicable disease program under National Health Mission. So it is a component of National Health Mission. The students should know about this thing. Now, the goal of National Program for Control of Blindness, when program was started in 1976, the goal was kept that we should reduce the prevalence of blindness to 0.3% by the year 2000, but we could not achieve that. So this goal was revised to 2020. And recently, as per the National Health Policy, which came in 2017, the goal has been further revised to reduce to 0.25% by 2025. The indicators for national health policies are till 2025. Globally, WHO is also taking initiatives. They started a program called Universal Eye Health, a global action plan. In fact, we were involved in actually preparing guidelines for this program in 2013. So program was started in 2014, and the aim of this program was to reduce the prevalence of avoidable visual impairment by 25% by the year 2019. And it was compared, the baseline was the prevalence of 2010 was taken as baseline. WHO gave figures for blindness and visual impairment for all the countries in the year 2010. So it was decided that in the next 9 years, by 2019, the prevalence should reduce by prevalence of visual impairment should reduce by 25%. So as far as National Program for Control of Blindness is concerned, it is at the highest level, it is in the ministry. There are actually two divisions. There is the bureaucratic division, which is managed by Ministry of Health and Family Welfare, and where joint secretary level person in Nirman Bhavan, he is the head of the program, and all the financial powers are with him. On the other hand, we have a technical division under Director General of Health Services and one DDG level person, Deputy Director General person. She's the head of the program, who actually looks all the technical issues related to the program. So one is bureaucratic guidance are there, other side we have the technical guidance. And also at the state level, we have state health societies, and at district level, we have district health societies, which actually manage this program. Now, some good figures for our country, which I expect that optometry students should remember. This is just basic figures, and we are not going to all details, everything. This is about how program actually gone in our country. In 1971 to 74, ICMR conducted the first survey, which is the first national survey in the country related to blindness. And at that time, the prevalence of blindness was 1.38%. And based on that, the government of India started this National Program for Control of Blindness. So I just cleared that from 1.38% to 0.3%. That was the target. In 1986-89, with the help of WHO, we did a midterm evaluation of the program to see what is the progress. And unfortunately, you can see, instead of reduction in blindness, it was further increased to 1.49%, a setback for the program. In fact, that was the time from 89 to 92 when major initiatives were taken. WHO funded a lot of funds for the program, for building of operation theater and wards. World Bank started a major program from 94 to 2001 for cataract surgical services. In fact, cataract was responsible for more than 80% of blindness in 1986-89 survey. And so cataract surgical service program was started. And in 2001, that was the final evaluation of the program was conducted. And there was nearly 25% reduction in blindness, from 1.49% to 1.1%. And then in 2007 also, another national survey was conducted, known as the RAB survey, the Rapid Assessment of Avoidable Blindness. And in fact, I was part of this survey and through RP Center, and that survey got a prevalence of 1%. So 1% population till last year we were saying that 1% population of India is blind, and taking as 1% of total population, we were saying that 12 million people blind in India in 2007, and since then the same figure was quoted. But you must remember the definition of blindness here during the entire this period. The definition of blindness was presenting visual acuity less than 6/60 in the better eye. This was different from WHO definition. WHO used the definition as of blindness as presenting visual acuity less than 3/60 in the better eye. So must see that WHO was having a different definition and NPCB was having a different definition. Since 2012, we started a kind of advocacy from our side that the definition of WHO and NPCB should be same. Fortunately, in 2017, decision was taken, and the definition of blindness was revised to less than 3/60. So as far as blindness is concerned, with both WHO and NPCB currently, the definition is presenting visual acuity less than 3/60 in the better eye. Please remember this definition. And beside this, WHO used this term visual impairment. Visual impairment overall, they means all the people with the visual acuity less than 6/18 in the better eye. Just remember, as per WHO, blindness is a component of visual impairment. You know, such definition, even I was not aware when we did national survey. At that time when we are discussing about this issue, then I came to know that the blindness is also a component of visual impairment as per the WHO definition. Otherwise, they define visual impairment into three different other components also: severe visual impairment, moderate visual impairment, and early visual impairment. Severe means less than 6/60 to 3/60. Moderate visual impairment was less than 6/18 to 6/60. And then early visual impairment less than 6/12 to 6/18. So just remember these components. Probably this slide is sufficient for all of you in future also to know the definition of blindness, definition of oral visual impairment, and also different categories of visual impairment. The key objectives of NPCB and visual impairment, I take the session for our optometrists, and I tell them that you can get a short note on each and every objective. So first is to reduce the backlog of blindness through identification and treatment. Here we mainly talk about cataract, because cataract is the leading cause of blindness, and the backlog due to cataract blindness is very high in our country. The second component is a comprehensive eye care facility. That means human resource, and basically infrastructure development for the country. Infrastructure at all level. You know, here I have written it starting from primary health centers, but nowadays Government of India is giving emphasis to health and wellness centers also, which are there at 5,000 population. So from health and wellness center, primary health center, community health centers, district hospitals, which are basically the secondary level care, and then medical college and regional institute of ophthalmology. So program is targeting about all these different eye care facilities in the country. The third component is basically developing human resource and for the eye care services. And as you all know, human resource mainly it is ophthalmologists and optometrists, but we also include eye care technicians, eye care managers, and ophthalmic nurses also. But main emphasis is on ophthalmologists and optometrists. In fact, there are various divisions in optometry. The Government of India is still persisting with ophthalmic assistant, diploma in optometry. Those things are also there. Then quality of service delivery. This is extremely important, because you'll surprised to know that the blindness due to surgeries, this is becoming an important cause of blindness in our country. So we have to give emphasis to quality and eye care. That is extreme need at this stage. Then securing participation of NGOs and private practitioners. In fact, this is the only program in our country where NGO participation is probably the best. Currently, more than 2,200 NGOs are registered under NPCB, and it is so good that more than 60% of the surgeries are being provided by NGO sector. NGO sector is working much more than the government sectors, and there are some strategies to involve private practitioner also, and that include Ayushman Bharat scheme. We can discuss a bit about that also. And of course, last but not least, and probably the most important, is enhancing the community awareness about eye care. I have visited all over the country. We used to think that people have good knowledge of, at least about cataract and cataract surgical services. But when I did this national blindness survey, I was shocked that the awareness is so poor in our country. People are not aware that surgeries is needed. They can revert their blindness, and the surgery is available free of cost in government sector. Those things people are not aware in our country. So we need to give emphasis. I've been talking about this national blindness survey. In fact, I feel proud and privileged that I was made principal investigator for probably the biggest ever survey in not only India but globally. This national blindness and visual impairment survey for the entire country. Previous surveys, actually, it was divided in such a way that 1122 survey were conducted by each institute. But this survey, this was conducted in 31 districts all over the country. And all the districts were covered by our team from AIIMS, from RP Center, Community of Ophthalmology. I must appreciate my optometrists. There are nearly 25 optometrists. They were associated with this national blindness survey. And the entire survey was actually, it was in their shoulders. In their shoulders, they manage everything. I can tell you the role of ophthalmologist is less important than optometrists in conducting these surveys. The prevalence is actually defined by the optometrist, and the causes are being defined by the ophthalmologist. So I don't expect you to remember all these figures, but just remember this first figure, that the prevalence of blindness as per this national survey in 50 plus population. Remember, the survey was conducted in 50 year and above age group. It was 1.99% in our country. And the second definition which we expect you to remember is prevalence of visual impairment. It is 13.76%. So just two figures. 1.99 is the prevalence of blindness in 50 plus population, and 13.76 is all people having visual acuity less than 6/18. And here I would like to emphasize that the gender association with blindness. You can see all type of blindness, whether blindness, severe visual impairment, moderate, early visual impairment, everything. You can see the prevalence is higher among women compared to men. This is important issue for our country. We need to give emphasis to gender, and more surgeries are needed in female populations. See, association of blindness with age, what a wonderful example. In 50 to 59 year, the prevalence was only 0.5%, whereas if you see 80 plus population, the prevalence is 11.6%. So it is very clear, higher the age group, higher the prevalence of blindness. Then within relation to residents, in rural India, you can understand we have nearly 70% of the ophthalmologists in urban population, which is nearly 30%. In rural population, which is 70%, we have 30% ophthalmologists. So you can understand blindness will be higher in rural India compared to urban population. And as far as education is concerned, I was never aware that there is so much of gap between illiterate and literate population. In illiterate, the prevalence was 3.23%, whereas in 10th class and above, it is just 0.43%. Now this is showing like district-wise prevalence of blindness. What I want to share that in southern India, like this is part of Kerala, prevalence is very low, 1.08%. Goa it is low. In Gujarat, we are doing more than 15,000 cataract surgeries per million population. The prevalence is low. Whereas in UP and Andhra Pradesh, these are the states where we found that prevalence of blindness was very high. Because not in UP, it was very high, and average for the country is 1.99%. Now, when we submitted this report, RAB report, then the government asked us that we need prevalence in general population, overall population, not in 50 plus population. So we estimated the prevalence. We did another survey in 0 to 49 age group. We identified the prevalence in that age group also. And finally, with the help of our statistician, we got the prevalence, estimated prevalence in overall population. So prevalence of blindness in overall population is 0.36%. You know, I'm sharing these figures, they are not yet published. So in future, these, for at least for next 10 years, These figures will be used by National Program for Control of Blindness, and in fact by everyone in our country. The prevalence of blindness is 0.36%, whereas prevalence of visual impairment in general population is 2.55%. These two figures, please remember. And what is the importance of these two figures? As I mentioned, the WHO has a goal for visual impairment and blindness that they reduce by 25%. And see the change in our country. In 2010, they estimated that the prevalence of visual impairment in India is 5.3%. And what we have got in 2019 is 2.55%. So it is not 25%, it is 51.9% relative reduction in visual impairment. This is probably the biggest achievement for our program, for our country. Now, internationally, it will be recognized that India is one country with such huge population, and we are able to reduce this burden of visual impairment not only by 25%, but more than by 50%, and also blindness by nearly 47.3%. Now, another important issue, what are the major causes of blindness in our country? You can see this figure, 66.2% of blindness is still due to cataract. So it is very clear that cataract is, when in 1981-82, when 86-89 survey, it was 80%. 2001 survey, it was responsible for 62%, and even now 66%. So it is very clear. Cataract blindness is the key, and we know the reason, because the life expectancy is increasing, and it is definitely associated with the age. That's why cataract will remain as bread and butter. And so we have to give maximum importance to cataract blindness in our country. But the second important cause of blindness, which has emerged in our country, is the non-trachomatous corneal opacity. 7.4% of blindness due to corneal opacity. This is huge. In 2001, it was just 0.9%, and now it is 7.4%. So you must understand, we have to give importance to corneal opacities program in our country. The third thing which I would like to mention for your optometrists is the cataract surgical complications. It is 7.2%, very, very high. Just see, in 2001, it was responsible for 1.2% of blindness. Now it is 7.2%. So these two issues, corneal opacity and complication due to cataract surgeries, they have come out to be as a major cause of blindness beside cataracts. So for you student, you must remember, these are the three priorities in our country. Beside this, after that is glaucoma and posterior segment. Diabetic retinopathy, in fact, we were thinking that it may emerge as a major cause, but DR is still responsible for just 1.2% of blindness in our country. That is something which we must understand, that though we are diabetic capital, but as far as blindness proportion is concerned, so we blindness due to DR is not so much. We also included diabetic retinopathy component in this survey, and I would like to share one slide related to this thing. As I mentioned, blindness due to DR is just 1.2%, but if we see overall prevalence of diabetes in our country is 11.9%. 11.9% of 50 plus population is definitely diabetic. That included 8% non-diabetics and 3.9% new diabetic. And among diabetics, the prevalence of diabetic retinopathy is 16.9% and diabetic maculopathy is 7%. Whereas where public health experts are mainly concerned is the sight-threatening diabetic retinopathy, it is responsible for 3.6% among all diabetics. So what I want to share here is that in future, at present, though it is just 1% because majority cataract, but in future, if we do more and more cataract surgeries, probably diabetic retinopathy may emerge as one of the important cause of blindness in our country. So as far as this entire survey is concerned, our priorities are concerned, we have to give importance to cataract, refractive error for visual impairment, and corneal blindness, childhood blindness, glaucoma, and diabetes. These diseases, they will remain as a priority disease in our country. And in fact, I must share that as part of Vision 2020 Right to Sight, we are giving emphasis to these diseases only for the country. So, as for NPCB, you can see the targets and achievement if you want to remember these figures. We are doing nearly 66 lakh surgeries per year in our country at this stage, which is a huge number. And this referred to a cataract surgical rate of nearly 5,000. You students should remember what is cataract surgical rate. It is the cataract surgeries conducted per million population per year. So in our country, we are doing 5,000 cataract surgeries per million population per year. Beside this, the program also give emphasis to disease like diabetic retinopathy, glaucoma, ROP, pediatric keratoplasty, and VR surgeries. And target was 2 lakhs for last year, and we achieved 6.14 lakhs. That means achievement was much better than the targeted one. School children program for refractive error, nearly 9 lakh spectacles are targeted, even 8 lakh spectacles were given. And corneal blindness, the target was 55,000 cornea collections, and 68,000 corneas were collected under NPCB. You must remember the key program activities. The first is the free, first and foremost, is free cataract surgeries. Nearly 50% of the national program budget is spent on free cataract surgeries. Second, the school vision screening program, that is providing this myopia is important cause of visual impairment, and it estimated that nearly 90% of visual impairment in children is due to myopia. So we have school vision screening program for this, and free spectacles are distributed to school children. Collection of donated eyes, that is free keratoplasty surgeries. Diagnosis treatment of other disease, DR, squint, glaucoma, low vision, childhood blindness, and ROP. Infrastructure upgradation. As per the objectives, these are the things: training of eye surgeons and PMOs, IEC activities, and having monitoring workshop. You must remember how much amount is being paid by government to NGOs for performing various surgeries. 2,000 rupees for cataract surgeries and other surgeries, 7,500 rupees for keratoplasty, 10,000 surgeries for VR surgeries. For spectacles in school and even for presbyopia, it is 350 rupees per pair of spectacles. And for cornea collection, it is 2,000 rupees for eye bank, where processing facilities available, and 1,000 rupees per pair in case of eye donation centers, where processing is not done, only corneas are being collected. Now, as I mentioned, cataract is the most important like disease for our country, and we need to give emphasis. And recently, we had a meeting under NPCB. There's a committee. I'm fortunately member of that committee, and these are the key points which have been discussed and planned. That these are the issues which should be taken care for actually for a program for eliminating cataract blindness backlog in our country. We are targeting that will eliminate cataract backlog by the year 2025. And you know, number of surgeries estimated per year for that is nearly 1.15 crore surgeries needed per year. You know, we before COVID we were thinking it may be feasible, but because of COVID, the entire program has been disrupted. And I believe we have performed hardly 10% of surgeries during this period. Like this, surgeries were started only in May, and hardly 10% of the targeted surgeries have been performed this year. But what we expected is that we first assess the magnitude of cataract blindness in every district. Then we should utilize our volunteers, the ASHA workers, to screen the blind people in the community, blind and visually impaired. And they should also refer those people to our health centers, to our eye care centers. Creating awareness in community, that is also being planned through ASHA workers and AIIMS and other staff workers. Then Government of India are planning to giving special funds to districts for infrastructure, for equipment, for providing human resource. And this is under consideration at the PMO office. And very soon, hopefully, a major program will be started for cataract elimination. And in fact, it is planned that in every district, we should target high volume cataract surgeries in mission mode. That is the need. And of course, quality is the key. But because of COVID, as I mentioned, these may suffer, and we need to think of some additional priorities after COVID. This I'm not discussing right now, because let it be finalized, then we can discuss. But one of the important issue is the student must know that we have Ayushman Bharat scheme, that is Pradhan Mantri Jan Arogya Yojana, under which not only ophthalmology, but in all kind of packages are there, nearly for 872 packages, and 1573 procedures for different disease in different departments. And under ophthalmology, there are right now 42 procedures and 53 packages are there. So it is suggested that all private practitioners, all NGOs, they should register themselves under this scheme, because in an NPCB we get nearly 2,000 rupees, but under this scheme, PMJ scheme, these NGO can get up to 7,000 rupees for cataract surgery. So it is suggested they should enroll themselves. For school vision screening program for myopia, must remember few lines. It started way back in 1994, and the process that teacher, they are being trained for initial screening. They refer children at the second level for the ophthalmic assistant or optometrist for refraction, and at third level, the district agencies, they actually they nominate one agency for spectacles, and they're supposed to provide free spectacle to school children. In fact, I suggest if you people are involved in this program, try to explore the district agencies which are providing free spectacles. At least in Haryana, I know the state program officer is extremely positive, extremely positive. He can be very helpful in providing free spectacles if you are involved in program with them. Now, a few points about trachoma elimination. This is one disease which we aim to eliminate by this year, 2020, and it's as a part of global elimination of trachoma program, GT program. And I'm happy that even for this trachoma program, I was made principal investigator for the country, and we conducted 27 surveys, 20 surveys in 27 districts, either trachoma rapid assessment or trachoma prevalence surveys. And based on that, in 2017, Government of India declared that at least in children, that means between less than 9 years of age, trachoma is eliminated. That was something very, very like positive thing for the country. We submitted the report. The Health Minister of India at that time, Naddaji, he invited our team, and we submitted report to him. We presented the data, and then he declared that active trachoma in India is eliminated. But as far as trachoma in adults, what is we call as trachomatous trichiasis, it is still not eliminated, and we need to work for that. I remember Dr. Sumit was involved in one of the national level planning and this trachoma elimination strategy, where we conducted training for state program officers and district program managers. In fact, we are in the process. The government of India is planning a major survey called TT only survey for next 2 years, and only after that, if we get prevalence lower than as designated by WHO, then we can declare that trachoma is eliminated in our country. So in fact, we hope that RP Center will be a major partner for these surveys, and if possible, we will be very happy if your Department of Health Sciences, they can be our partner for this survey. We will be very thankful to you, because it will be mainly done by the optometrists. Now, another priority is strengthening primary eye care in our country. The student must understand that we are mainly working for primary eye care. But as far as Government of India is concerned, I'm showing this slide for last 15 years now. See the lowest level, Vision Center, which is primary eye care. These are the plan and achievement by 2020. In 2004, we did under Vision 2020 Right to Sight, we had a planning that we should have 20,000 vision centers in our country. 20,000 vision center means one vision center for every 50,000 population. But unfortunately, even now we just have 4,000 vision centers. This is one area where optometrists need to lead. Optometrists or ophthalmic assistant, they are supposed to be there in the vision center. They provide the services, and it is unfortunate that we are having such less number of vision center in our country. Probably it is because of COVID. Now the Government of India is giving a lot of emphasis on vision centers, and they are planning that more and more vision centers should be started. It can be through a fixed facility center, like it can be integrated primary health center, or it can be a standalone primary eye care centers. Government of India promote that. we should have integrated primary health center. Integrated primary health center means, like, if we already have one we have a primary health center, then we can just add on one optometrist in PHC. So that means integration is there. The advantage is that we don't have to do much publicity for this. Patients are already coming in primary health centers, and patient with eye care problems can be seen by the optometrist. The second advantage is, even at this stage, the optometrists are not permitted to prescribe any medicine in our country. So they can do the spectacle prescription, and if patient is having any other eye disease or ocular problem and need medicines, that can be prescribed by the doctors who is there at the primary health centers. So what services we expect at the Vision Center is not only early detection treatment of eye disease, but we are looking forward that even the first level management of eye care emergencies can be given at the Vision Centers. Vision testing and reflection, that is the key. Dispensing of spectacles is must. Then, at this time, we expect that there should be a very good linkage with the base hospital, where surgery etc. can be provided. That is must. Without that, it will be difficult for a vision center to sustain. Even post-operative follow-up can be provided at the vision centers. And finally, the training of the ASHA workers and other volunteers. And nowadays, during COVID time, it can be done with the help of, I believe, with the help of telehealth methodology. So it include all kind of preventive, promotive, curative, and rehabilitation services. So just remember, what we feel is that Vision Center are not responsible only for refractive error services. They are for all type of disease, and like, it should be promotion, prevention. It can be cure, and rehabilitation component should also be there. But now, because of COVID-19, there are certain new normal norms are there. For new normal, for everyone is basically having a social distancing of more than 2 meters, of ideally 2 meters, minimum 1 meters. The government of India is recommending 2 meters as per National Program for Control of Blindness. Hand washing with soap and use of sanitizers, using masks, use of disinfectant spray, travel restrictions, and avoiding social gathering. Whereas when we talk about eye care providers, then the new normal which we need to add is the thermal screening for all patients using infrared technology before coming to the OPDs. Then clinical screening for to rule out any COVID-19 patient. So suspected COVID-19 patient, they should be referred to the health facilities instead of seen by the ophthalmologist. But in case any emergency is there, then they should be seen under precautions. Using of PPEs in form of N95 mask, gloves, etc., and face shield. That is the need of the hour, and that should be done. Then using, whenever you use your equipment in your vision centers or hospital, they should be properly disinfected. Government of India is currently promoting teleophthalmology in a big way. Teleophthalmology and telehealth. Telehealth is related to eye care training and health education. So all these things are being promoted. This is our suggestion for a model vision centers. If your university is planning, that you should have 4 different like component, a separate entry and separate exit. In the entry, initially it can be hand washing and screening for symptoms, including the temperature. That means temperature taking with the help of infrared thermometer. At the second level, it can be the pre-screening. That means taking visual acuity with the help of charts. Then we can have a waiting area where proper distancing should be followed, social distancing. After that, the patient coming for refraction to optometrist. And the final counter, it is basically counseling and dispensing of spectacles. A separate entry, separate exit. Probably this is the way what we need to develop our vision centers with all the COVID precautions. Probably, and what we are expecting that more and more awareness program should be there for our eye care. And in fact, RP Center have developed such kind of posters in case you need for your centers or your hospitals. You're most welcome. We'll be happy to share these posters, even the soft copy of these posters with you, and can be used for eye care awareness in our country. One more component which I would like to emphasize is health and wellness center. In fact, this is a major priority, not under NPCB, but for entire health department in Government of India. It is actually sub centers are being turned into a health and wellness center, where priorities has been given to 12 different category of disease, including eye care. So eye care is one of the component in health and wellness center. And recently, a task force was developed, and I was chair for this task force, and we have submitted our guidelines. And in fact, what we want that the optometrist should lead this entire program, and they should act like a trainer for the people who are working at the level of health and wellness center. These are the recommendations in this program. Not only as trainer, but they will be the person whom these ASHA workers and Anganwadi workers and ANMs, they'll be referring cases as to their vision centers. So here it's a time for optometrists to lead the entire program in our country, entire primary eye program, and government is giving all the emphasis. In fact, it is planned that by the year 2022, there will be 150,000 health and wellness centers in our country. ASHA worker involvement is key. In fact, in recent we completed one PhD in our department. What we are expecting that ASHA workers can and should be used in eye care program, basically for three different areas. It is for eye health education and awareness, for identification of blind and common eye conditions, and mainly for timely referral and follow-up. We have in our study we have found that they can be effectively utilized in all eye care activities in our country. So this is the thing which I want to share. To summarize, I can say national program is probably one of the what we feel is one of the best program in our country, which have almost achieved the target of zero point 0.3, having a blindness figure of less than 0.3. And not only for our target, but even the WHO targets of visual impairment have been achieved. But that do not mean that we don't have work now. In terms of, as per the National Blindness Survey conducted, cataract is still the leading cause of blindness, and we need nearly 1.14 crore surgeries in our country every year if we really want to eliminate cataract blindness. As far as visual impairment concerned, beside cataract, refractive error is important cause where optometrists have to lead in our country through vision centers. And this is one area we need to strengthen a lot, the primary eye care services, and where we need our optometrists, our country association, Optometry Association, that they should come out and lead this program. Thank you. Thank you very much. Thank you. Thank you for giving me this opportunity to present. I hope it was not so boring. Thank you.
Thank you. Thank you so much,
Thank
sir.
you so much.
Boring is not the word, sir. It was really enlightening. And I must say, whenever I listen to you, I always learn so many things. And I must have took in hundreds of the snapshot. I think screenshot of I think every slide. And I was seeing that the students have already started sharing the screenshot of your presentations, and we have recorded, and this is would be a masterpiece for us. You have covered everything, like what are the as per the components of a health system, like what are the governance of our national program for control of blindness, how the finances happen, what are the technology used. Then, sir, you talked about the various social determinants of health. Students knew about the urban-rural disparity, the gender inequality, and how these social and environmental factors, in fact, aging affects our eye health issues. And you have so inspired and motivated our optometry students that how they can become a part of the mainline national program of control of blindness. And what the beautiful all about this presentation is the bridging between the ophthalmologist and non-ophthalmologist human resource. And I always envision that without the training and empowerment of a non-ophthalmologist human resource, we could not create a sustainable or can strengthen the primary eye care in India. And your vision about making efficient use of optometries and ASHA worker is commendable. It's most inspiring for all of us, and it's need of the hour. Thank you very much, sir. And about now the queries, if any student, it was a wonderful lecture. I think that's why you are the best teacher in India for community ophthalmology. If any doubt, any query, someone wants to post, please, you're welcome.
I think there's only one question so far. It is the reason for this non-trichomatous corneal opacity, why it has increased. So, previously in the past, we used to say the major cause of corneal opacity. It was mainly trachoma, and it was second important was the corneal opacity due to vitamin A deficiency. But the trend has totally changed. Now, for corneal opacity, it is mainly the ulcers, the corneal ulcer, that is an infection, which is mainly responsible. The second important cause is the corneal injuries. Mainly the farmers and they get the corneal injury while working in the fields. So and there are other reasons for corneal injuries also. You can see the children playing the festivals, the Holi, and all those things. So the corneal injuries and then the infections are currently the major cause of corneal blindness in our country, and that lead to corneal opacity. This is the change in trend. So vitamin A deficiency and trachoma has reduced significantly.
Sir, there is one more question that after this Vision 2020, is the government or national bodies are planning any other initiative? Like after Global Action Plan, we had Vision 2020 and now it's concluding. So whether it will be carry forward or there will be some new venture coming on.
See, in fact, fortunately, I'm part of this executive committee of Vision 2020 as vice president. And in fact, we are in touch with Vision 2020 bodies of all other countries, Australia, Africa, USA, etc. And we are in the discussion that what should next. It's 2020 now, and what should we plan for next 2030, etc. So still it is in process. The things are not yet finalized. In fact, some targets will definitely be decided in for 2030 as per sustainable development goals. That is the aim, but still it is in process, and I hope that by the end of this year we will come out with some targets and but at present it is not there. At present it is not there, right?
And sir, on behalf of our Department of Optometry, I thank you so much, and I assure you that without any conflict of interest or any additional unconditional this thing, we are always very ready to be part of any venture or any program where you need an optometry as a part of that. You mentioned about the vision centers or any other survey. We are always ready. You just have to give us orders, sir. It's not about anything. You just say, and our students will be there, and it's without
So
any.
till that time, Monica ji is
That's,
there or Sumit is
that's
there.
a commitment, sir. That's a commitment because I
Probably.
think it is a learning. I think whatever we teach in our optometry school is like diabetic screening, glaucoma, refraction, has no meaning if we are not able to deliver this kind of sensitization to them to understand where the role is. And you rightly said we need them in vision centers, and this message has to go down there, that it's not only looking at the top urban hospitals as employment, but there is a lot more to be done at the grassroots level where they should see their role as. And Dr. Sumit, as you said, it's totally unconditional support. Sir, you have to tell us what to do. You have to just give us the command, and we'll try to be the best in it, sir.
Definitely, as I mentioned, till the time Monica ji, you are there and Sumit is there, you are probably the best people for us to work as far as community ophthalmology is concerned, and whatever possible is there from our side for Haryana and in for the country level, we would be happy to involve you and your team, whether it is research, epidemiological research, or even service-based programs are there. We shall be very happy. In fact, the new thing which we are looking forward is developing mobile vision centers using our mobile van, the Christopher Blindness mission. They are happy to provide us van actually, and I'll be happy if we can post that van to some of your areas also, like once in a week or something like this. That can be a beginning of our partnership actually. So I'm
Thank
looking
you.
forward to that.
Thank you,
Pleasure,
Dr.
sir.
Sumit, to take
Thank
it forward. And I think we can, Sir Ashley, so you would like to wind up. But before everybody exits, what is the percentage of visual impairment and blindness in more than 50 years of age. So if you have read through Sir's presentation, and remember each student will have to go through an MCQ test. Unless you do that, you don't get a certificate of participation with Sir's signature. Thank you.
Thank you.
Thank you, everyone.
Thank you.
And Malika, you may conclude the session now.
Yes, sir. Thank you so much, sir. Thank you so much. Knowing the current priorities from NPCV, it is as if we have readjusted our sails in this venture, in this voyage. And now we know in which direction we have to go. Untreated cataract, non-trachomatous corneal blindness, ulcerations, and post-cataract surgery failures or complications. These are three uprising things for which we can genuinely take care of, which can be brought down upon by simple awareness amongst everyone. Thank you so much, sir, for teaching us, for leading us. Thank you so much, sir, for sharing the most precious thing you have, that is your time, with us. We are amazed, we are mesmerized. Ladies and gentlemen, I would like to point out at one more thing which he said. Now, this is the proof of leadership. This is the proof of his humbleness, his greatness. Look at the way he remembered the team of 25 optometrists who worked under him, who worked for him, way back in time. Now, ladies and gentlemen, this is the kind of support, this is the kind of co-management we need from ophthalmologists, and nothing can stop us from preventing blindness in this world. Gratitude is so much in our hearts, sir, that a lot can be said, but nothing would be enough. Thank you so much for sharing this knowledge with us. And sir, thank you for all the hard work that you have done in your life, because all the things that you have done, it's actually very inspiring. It has mesmerized and motivated us. You have made us feel that we have got the power to make an impact in the world. As Mahatma Gandhi says, that we have to be the change we wish to see in the world. I hope that students over here have absorbed your positivity, your aura, your determination, and we become great people, great optometrists to save the world from blindness. Thank you so much, sir. Thank you so much, our dear teachers, who made our concepts of grassroots level so clear that we could understand this advanced lecture so well. Thank you, Professor Monica Chaudhary, ma'am. Thank you, Dr. Sumit Grover, sir, for everything. Thank you, students, for your very kind attention, for your time. Thank you, everyone. You may have a great day.
Thank you, Malika. Thank you. So nice. I'm always available for the university, for the student. Thank you. Thank you very much, Malika.
Thank you, sir.
Thank you, sir.
Thank you.
Bye. Bye.
Thank you, sir.